So we're looking at the midwifery model of care. Midwifery model of care. So I think the midwifery model of care should just be all about you are trying to establish, what a midwife should be able to cover, okay, as her services to a patient. You understand? So for the midwifery model of care, it just has to do with, right? It says a holistic is an evidence-based approach, okay, to what a midwife is supposed to do towards a pregnant woman, a woman in childbirth, a woman she has given birth, okay. So it centers on the belief that these are normal life processes. So these individuals, you don't have to treat them with hostility, okay. Of course, you need a woman to be pregnant and give birth so that what our population can continue going, okay. So it emphasizes partnership, respect, and individualized care, and has been shown to what reduce unnecessary interventions and improve the outcomes for mothers and babies. So sometimes all what a woman will need is care, okay. It's when you don't give this care that complications can set in and we are needing surgeries and all of that. So most of these surgeries, we can prevent them from just caring for what a pregnant woman, a woman that is giving birth, a woman that is after she has given birth. So core principles is this: pregnancy and birth are natural. So midwives, they support physiological birth and should avoid unnecessary medicalization. So there are some one or two massage techniques that midwives they know. So some of these things you can do them naturally. You can induce birth naturally, okay. You mustn't be going for some drugs that might be bringing some side effects, all of that. Woman-centered care focus on emotional, social, cultural needs of the individual. Continuity of care. So care should be what sustained throughout the reproductive journey. Informed choice and autonomy. So if you want to actually do something to a woman, you should make it known to her. You should explain to her. She should be able to take a decision. You explain things to her, okay. Minimal intervention. So even if anything is needed, okay, it should be something that is soft, not really something so harsh on the patient. So key components of the model is what monitoring the well-being of the individual. So both physical, psychological, social assessment throughout pregnancy. Individualized education. So counseling and preparing the person for birth and parenting. Hands-on labor support, postpartum care. Okay. So if you run out of what resources to take care of a patient, always refer them. So global recognition is the International Confederation of Midwives and World Health Organization. They endorse midwife models as cost-effective, right-based strategies to improve maternal and newborn health. Okay, so midwife care is especially impactful in low-resource settings where patients don't really get to see doctors always. Okay, so midwives are always there to mediate you and the doctor. So it will reduce maternal death, promote respectful care.